My background is in health psychology, and I'm, I guess, broadly speaking, interested in chronic disease self-management, but with a particular interest in women's health, and particularly, I guess, kind of stigmatized symptoms and areas that don't receive a huge amount of attention, be that through research or medical education and so on. So I'm going to talk a little bit in general about health psychology today, and as it may relate to lipedema. There's unfortunately very, very little research in the area of health psychology as regards lipedema, which I think has been a theme of today, that there's limited research available in lots of domains. So I think that's something we really need to think about going forward. But I guess just to start off, I'd like to talk about what health psychology actually is. When we think of psychology, we tend to think of clinical psychology and, lying on the couch and talking about mental health. Whereas health psychology is really more born out of the evolution of how we think about medicine from a very biomedical model towards a more biopsychosocial model of health and illness. So traditionally, we think about our health in terms of sort of our physiological aspects. So things like our genetic predispositions, our age. But this biopsychosocial model that kind of led to the development of health psychology takes into account more the social and psychological impacts on our health and how those affect how our health progresses across the lifespan. So in addition to those biological factors that I've mentioned, we've got things like social influences, things like deprivation, socioeconomic status, social support and our interactions with others, as well as our psychological impacts and how those all can affect our physical health. So health psychology is really interested in the interplay between all of these different variables and how those affect our physical health and well-being across the lifespan. In terms of what health psychology can do, if we're kind of given the resources to be able to do that, our general kind of aim is to promote health and well-being. So we're trying to help people to live better, more fulfilling and healthier lives. In doing that, we need to take into account the kind of psychological and emotional aspects of living with chronic disease. Obviously, we've seen this kind of talk come up across the day so far, that having a physical health condition has a complex effect on almost every aspect of our lives, and we need to be able to take that into account to enable people to live well in the face of chronic disease, and also to kind of self-manage those conditions at home and how to interact with healthcare professionals also. We're quite interested in promoting health behaviour, so behaviour change is a big area that we would focus on in health psychology, so enabling people to self-manage conditions through kind of changing their behaviours, be that diet, exercise, taking medication, or attending to a healthcare professional when a symptom is indicating that maybe something needs further investigation. And I guess the final and probably the most challenging bit is health psychologists try to influence our healthcare systems. So improve the way that our healthcare professionals communicate with patients and go about providing that kind of care. In terms of what psychology and healthcare can look like, although I acknowledge it's incredibly difficult to access psychology services in kind of healthcare settings, and we've talked a bit about the postcode lottery so far, and it's no different for psychology services as well, depending on what is available to you where you live. I think there's a good argument for including health psychology in care pathways for lipedema going forward. And I think that's something that Talk Lipedema is really encouraging, so fantastic to see that. But as I've mentioned, access to existing services varies a lot, and it tends to be clinical psychologists that we meet. That's really, really valuable, obviously, considering the mental health impacts that living with a chronic disease can have. But health psychologists have a unique role that can be really helpful in enabling people to live more full and fulfilling lives. And I think we've mentioned a lot that psychologists currently, we tend to encounter them in weight management services, and that can really limit the kinds of support that they can make available to you. So I think there's scope for health psychology to have more wide-ranging impacts on the lives of people who are living with lipedema. Just a little quick kind of refresher, I guess. Clinical psychology, of course, would focus more on that mental health element, whereas health psychology is really more about taking into account those mental health impacts, those other factors that affect our health, and enabling us to change our behaviour to support our own health and well-being. So that unique insight can be really valuable. Though there is of course, overlap, and I don't want to kind of draw too distinct a line between clinical and health psychology. Indeed, there are clinical health psychologists that may have a really valuable role here as well. But I just want to kind of delineate the two disciplines and acknowledge that they have different sets of expertise and skills that can be useful for people with any long-term condition, particularly lipedema. I'm preaching to the choir here. I think everybody knows better than I what the psychological challenges of living with and caring for somebody with lipedema may be. It's well understood that it's not well understood by the public. So if someone who's experiencing initial symptoms of lipedema may not recognize what those might be, they may feel shame and self-stigma, and that may affect the likelihood of actually attending to a healthcare professional, which can contribute to delayed diagnoses. It's frequently misdiagnosed when people do attend to a healthcare professional, again leading to delayed diagnosis and potentially quite dismissive and harmful interactions. I think people, and often women, I think this is a common theme across women's health conditions, we bear the scars of those dismissive healthcare interactions, particularly when you're told that this is just part of life. I do a lot of menstrual health work, and we've talked about endometriosis, so things like period pain, you're told that's just part of being a woman. With lipedema, you're told you just need to lose weight, and that can be really, really harmful for people, particularly when they do eventually receive a diagnosis, which may bring about relief. We've heard that as well, but of course you're being told then that you're living with a condition that has no cure. And there are massive mental health implications of that. You now have to potentially change your behaviour for the rest of your life in order to manage that condition. You may be faced with anger at potentially the duration of time it's taken you to receive this diagnosis, at the lack of available treatment options to you. You may also experience grief for the person that you were before, and all the things that you thought your life was going to be may be now different. And of course, as we're well aware, having a condition like lipedema has impacts on other areas of life as well. So I think it's really clear that psychology has an important role to play in this particular condition. Of course, these challenges affect how we're going to respond to our illness, but also how we're going to self-manage it as well. And the process through which this happens is something called self-regulation. And self-regulation is something we're doing all of the time, but it's potentially something that we can harness to improve our own self-management experiences and behaviours. So understanding what's involved in this self-regulation can enable us to manage our health more effectively, and can also enable our healthcare practitioners to provide more optimal support. So in terms of what self-regulation is, it's really just that ability to understand and respond to the thoughts and emotions and behaviours we're experiencing in response, I guess, in the context of lipedema, to a health threat or a threat to our identity. And what's really key for me here is that it emphasises the active role that we have in managing our health. I think something that people with lipedema may experience is this feeling of being out of control and having no control over what's kind of going on with their health and their lives. Tapping into our self-regulatory process allows us to regain some of that control and care for ourselves more effectively. It's also something that we can practice, that we can work on, and we can get better at. So it's not something you're born with, you're just a great self-regulator or not. It's something that we can teach, and that psychology services can really support people to develop over time. And in practice, I guess, as I've mentioned, it's something that we can do at home and we can use in our kind of day-to-day living, but it's also something that healthcare professionals can harness to provide more appropriate care. And there are ways that we can measure self-regulation and understand what are the thoughts and emotions that might be holding somebody back from managing their condition effectively and from living a fulfilling life. And there are those tools that we can use as healthcare professionals, even in the face of limited resources currently for health psychology services. This is something that GPs or other physicians can do now with limited resources and training. So it's something that we could potentially implement quite easily. I'm not going to talk too much about this, but this is just a schematic model of one of the kind of most commonly used frameworks in health psychology for understanding how self-regulation works. So it looks a bit complicated, but fundamentally what it boils down to is how we think and feel about our illness affects how we manage it. How we manage it affects how our outcomes look, be those physical outcomes or emotional outcomes. And based on that, we can decide whether what we're doing has been effective or not. And if it has been effective, we can keep doing it, and that's great. But if it hasn't, we have the opportunity to reflect and refine our coping strategies. And being able to identify what has kind of influenced us to respond in a certain way can enable us to do that more effectively. So I guess using the example of lipedema, some of the key initial emotional and cognitive responses tend to come over these 6 headings. So identity, what is this condition that I'm experiencing? What is causing these symptoms? If you can have a name for that, that can really help us to respond more appropriately. But as we've seen, diagnosis can be delayed, and that can have a really important impact on our cognitive responses. Consequences, what does this mean for me going forward? And this is where issues of helplessness and hopelessness can really take hold and lead to more maladaptive coping. Timeline, is this something that I have for a short time? Do I have it every day all the time, or do I have it for the rest of my life? Control, is there anything I can do to control this disease? Is there a pill I can take? Is there a surgery I can have? And an emotional response, how do I feel about this? And you can imagine when you're first receiving a diagnosis, how many negative thoughts and emotions we can have in that time. And I'm sure many people in the room have experienced this and felt a lack of support with that. These thoughts and emotions are key in our treatment and management of all chronic conditions, but particularly conditions that have that really wide-ranging impact on our lives. So how we respond emotionally and cognitively to our symptoms will affect the coping strategies that we will undertake. So if we're potentially afraid of finding out what the cause of a symptom is, we may delay attending to a healthcare professional, for example. If we have a perception that this is something we have the ability to control, we can engage in problem-focused coping and take active steps to change our behaviour. And this is a dynamic, I guess, sort of view of this, where we're almost testing a hypothesis with each of our coping responses to understand, is this something that has worked for me, or is there something that I need to change in how I'm thinking about this? All very easily said, but not so easily done. And this is where health psychology support can be really, really valuable. I guess we can have sort of negative and positive responses to a diagnosis or a health condition. Sometimes these responses are not accurate, and I take this as a real life example. It seems facetious, but this is from a real case study where a gentleman was painting a house and fell off a ladder. When he was in hospital being treated for the injury as a result of falling off this ladder, he was diagnosed with type 2 diabetes. And as a result, in this man's mind, the association was falling off the ladder gave me diabetes. So in the future, he may avoid ladders, but he may not avoid the behavioural factors that may have led to the development of the diabetes in the first place. Potentially a more relatable example would be if I'm experiencing pain, I may decide not to engage in physical activity, so may choose to rest rather than exercise, which may initially make the pain feel better, but can lead to the development of more significant problems down the line. So you can see how the way we think and feel about a symptom or an illness or a behaviour can have those detrimental impacts. So addressing those thoughts and behaviours early is going to be really central. Even if a belief is not accurate or is accurate, it may be not helpful. So some of those negative responses that we feel, anger, grief, sadness, that lack of control, they're entirely valid responses to being diagnosed with a long-term condition. Completely valid, but not helpful in the long term, particularly if the resources are not there to support us to move forward. So that is where this psychology work can really be valuable to help us to reframe and take back some of that sense of control that we've lost. So in terms of some things that we can do to help reframe our thoughts and behaviours, I am aware that I'm the only thing standing between you and lunch, so I will wrap it up quickly. I guess it's really important to recognise in a situation that we do have options. We are operating in a very difficult healthcare context. There are limited resources, there's limited information out there. So we don't have control over everything. We don't, but it's important to focus on the things that we can control. So recognize your options. In any situation, you can choose to approach it, tack it head on, or avoid. What's the most appropriate thing for you in that moment? If you're feeling entirely overwhelmed emotionally, avoidance might be the most adaptive approach in that moment, but maybe not in the long term. In every situation, remember, you have the choice to respond whatever way is most appropriate for you in that moment. It's helpful for us also to become aware of our emotional responses in the context of health and illness, and try and sit with some of those uncomfortable emotions and understand what the root of that is. And is there something about that emotion that I can change, that I can take forward and harness in a way that's going to enable me to live a more fulfilling life? And monitor your body. So I think that's something in chronic illness that we're very good at, actually, kind of symptom monitoring, and can become almost hypervigilance. But what I'm referring to here is monitoring how our emotions sit in the body. If you're feeling anger, where is that? Is that behind the eyes? Is it in the chest? Where is that? And recognize how you physiologically respond to emotions in the moment. And that will enable you to harness those in a more helpful and appropriate way. Again, really easier said than done, but it's something that we practice and we can get better at. And there are therapies that will specifically help us to develop these skills. So cognitive behavioral therapy, the GP who spoke earlier mentioned online CBT, which is a fantastic resource that may get around some of the barriers to accessing psychology support. Acceptance and commitment therapy is one that's particularly useful for people who experience pain. It's a very valuable kind of intervention that's largely based in CBT, but is a little bit more specific. But also mindfulness can help us to enable these practice. One size doesn't fit all, so they're not going to be a cure-all, and they're not going to suit everybody. Particularly mindfulness, I think it's very popular, but it actually can make things worse for some people. But it's worth having a go and figuring out what works for you, because that's what we're going to need to sort of figure out, that individual level of support that's required for each individual person, because we don't have good data. I think that's another kind of take home that I'm coming away from the day, that there's a lot more data that we need to really refine our approaches to supporting people with lipedema in these ways. So looking forward, I guess, from my perspective as a health psychologist, but I think some of this will apply more broadly to the other disciplines that are represented here, as well as the people who are living with lipedema in the room. I think it's clear that health psychology has a place. So this is one element of what we do, the self-regulation work, but I could have talked to you all day, and I'd love to. So I'm really glad to have been here, and I'm very happy to speak with anybody who would like to speak with me about how health psychology can be used, particularly in lipedema. But I think it's really clear that there is a role for psychology in any kind of care pathway that's developed going forward. I think there's room for training for health professionals on these biopsychosocial approaches and enabling healthcare professionals to deal with more of the psychological factors that affect how their patients thrive and survive. It's clear that research is needed. So what I've spoken to you about today is taken broadly from the chronic illness literature, because there isn't anything on this for lipedema. And I think there's clearly a need for us to understand what are the unique cognitive, behavioral, psychological factors involved in determining how people are going to respond to a diagnosis of lipedema, and how they're going to be enabled to properly self-manage that condition. And I think it's really vital that people living with lipedema are central to that conversation and deciding what that research agenda looks like. Thank you very much for your time and your attention. I will be around for the Q&A later, and very happy to chat over lunch if that's useful. Thank you very much.